Still to come on Sky News. You're watching Sky News' Roy headlines this morning. The latest figures from NHS England show A&E departments are failing to hit their 4-hour waiting targets. Debating that shortly. If this is a crisis in the NHS, what might the solutions be? Are there any solutions? Joining us now, Dr. Mike Galsworthy, who's an independent consultant and researcher in health innovation policy. And from Warwickshire, we have Dr. Youssef El-Gingihy, the author of How to Dismantle the NHS in 10 Easy Steps. Gentlemen, welcome both.
I think certainly in certain parts of the NHS and the country, if you speak to staff on the ground and from reports and leaks, there seem to be some hospitals which are clearly really not coping and really struggling. And that isn't surprising because what we've heard kind of constantly recycled is just a narrative of crisis, this mantra of crisis without any explanation of the root causes. The point, as I've repeated time and again, is that it's a manufactured crisis. It's due to deliberate government policies. The NHS will have endured nearly £40 billion in cuts by the end of this decade. That combined with the tens of billions being siphoned out of the NHS by the private sector means that it is really struggling to deliver care. And of course, some parts will be struggling less. But overall, there seems to be a significant deterioration.
Well, it's always very easy to say, if you've got well over 100 trusts, oh, look, some are doing OK. And then you can point to them and let the others drop off. And what are you going to do? Let it get down to just one trust that's surviving and say, look, that's proof that it can be done? You know, there's clearly a problem throughout the whole system that comes down to lack of funding, because pretty much all of our trusts used to be in surplus a few years back, and in 2014 our NHS was ranked as the most efficient in the world by an American charity. And now we're seeing most of our trusts in debt. We're seeing demand rising, but actual investment in our NHS stagnating. And so that's why we do actually have crisis at a level that we haven't had before. And the moment to deal with this, I came on here before the autumn statement and said, Sarah Wollaston and others are demanding more money for the autumn statement because we can see this coming. Over this winter, the wheels will come off if we don't do something now. What happened with the autumn statement? They prioritised Brexit, getting match fit for Brexit, didn't mention anything on the NHS in the written statement. In the actual verbal statement that Philip Hammond gave, he mentioned the 10 billion figure, which is being disproved, and hurried on quickly. That was irresponsible. Now Theresa May has painted herself into a corner on this, and instead of listening to everybody, she's maintaining this line.
OK. From your opening remarks, gentlemen, people have established that neither of you are fans necessarily of the way this government's going about things. Youssef El-Gingihy, let's reflect on what Simon Stevens said to the Health Select Committee yesterday. He drew some unflattering comparisons with the amount of funding that goes into other European health systems. Talked about the Germans getting something like 30% more funding for their healthcare systems. But they are fundamentally different funding models, aren't they? So how well does that comparison work?
Well, the point is that those European models tend to be mixed models, if you're looking at, for example, Germany or France. But the point is that the NHS, in its original model, which is publicly provided universal healthcare system, that is actually the most cost-effective model. That model of socialized medicine is more cost-effective than the European mixed models. So that's a key point. But I think the important thing to understand here is that funding, which everyone seems to be talking about, is all good and well, but it's a second-order issue. Because as long as you have the NHS not in its original model, it has now become a market system with market forces, private sector involvement. If you look at all the, well, a lot of the literature, if you speak to health economists, public health academics, the point is that the more you bring in market forces in the private sector across international healthcare systems, we see the same story, which is escalating costs. It is more expensive and not cheaper. So this is the key point. The primary point is that we need to restore the NHS as a public system.
Mike Galsworthy, Youssef makes the point that the most effective way to run a health system is by public spending, by taxation. Well, that's fine until you start having to tap the taxpayer for more cash.
Yes.
They don't want to do that.
don't they? Because there are a lot of indicators that they actually do. There's quite a lot of indicators, through polling and through just, go and ask people out there, that they do value the NHS, they do realise that it's world leading in efficiency, and they do understand that in the 21st century, public models can be based on competitions between hospitals with open data, with no need to have all the gaming that private companies do. So people do understand that, and I was talking to the cabbie on the way here, and he was saying, yeah, well, we should keep it public, of course, because it is a cheaper model.
Was he volunteering to pay more tax, Mike?
I asked him that, and he said, yeah, I think that'd be fair. So people actually do think it's fair, and they do understand that as the burden on health increases, then we do have to pay more in order to take care of ourselves, but also if we let the NHS become obsolete, it's going to cost us more in the future. We do have a brilliant system. Think of the NHS like a technology. Invest in the technology. Like, okay, this iPhone in my pocket, right?
I hope you've switched
SE, yes, I have switched it off, right? I upgraded from the iPhone 4 because that was getting old and clunky. Now, that newer version wasn't made by cuts, it was made by investment. Okay. And the NHS is full of research and innovation, improving efficiencies and surgeries, inpatient care, in data. We need to invest in that so we stay on top of all of this, which is a perfectly easy thing to do.
A&E departments getting clogged up Friday, Saturday night with people who should be in a drunk tank, not getting priority treatment. Youssef, what do you say?
Well, so this is going back to what Jeremy Hunt, for example, was saying in his statement to the Commons, which is to divert blame onto anything but these deliberate policies coming from the government and from the corporate sector. And you divert the blame onto soft targets, easy targets, such as lifestyle choices, the concept of the NHS staff, aging populations, anything, if you like. When it comes to these individual lifestyle choices, again, this kind of talk is from Jeremy Hunt and others is ill-informed, because we know, again, if you speak to academics and so on, we know that health outcomes are actually generally directly correlated to your socioeconomic status. So the more affluent you are, generally speaking, the better your health is, the longer your life expectancy, the later you are likely to get disabled or ill. So when it comes to people's health, it's really not very evidence-based to start blaming individuals.
Okay, Youssef El-Gingihy and Mike Galsworthy, doctors both, thanks very much indeed. Appreciate your time today. We didn't.